You've probably been told the same thing for years: cut carbs, eat less, control your portions. But here's the uncomfortable truth most people never hear. If your blood sugar is still rising, it's not because you're undisciplined. It's because the advice itself is incomplete. What's quietly driving diabetes progression isn't the food you fear the most. It's the invisible metabolic damage happening after every meal, even the ones you think are safe. Insulin resistance doesn't announce itself. It builds silently meal by meal, while standard guidelines keep pointing you in the wrong direction. And the real risk isn't today's glucose reading. It's what happens months later when A1C won't come down, medications increase, and complications appear without warning: nerve damage, vascular stress, fatigue that no amount of willpower fixes. The problem is that most people are focused on what to avoid instead of understanding what actually restores insulin response. And that single misunderstanding is why so many are doing everything right, yet still getting worse. Once you see which everyday foods quietly work with your biology, not against it, the entire strategy for controlling blood sugar changes. And what you're about to hear may directly challenge what you've been told before, but it explains why nothing else has worked long-term. When you think about foods that affect blood sugar, eggs are rarely the first thing that come to mind. Most people barely think about them at all. They're simple. They're ordinary, and that's exactly why their impact is so often underestimated. But if you look closely at what actually happens in the body, after a meal, eggs behave very differently from almost everything else on the breakfast table. An egg doesn't trigger blood sugar the way bread, cereal, or even fruit does. One large egg contains about 6 grams of high-quality protein, 5 grams of fat, and less than 1 gram of carbohydrate. From a glucose perspective, that makes it almost neutral. And that neutrality matters because it gives your system something rare: stability. In controlled studies, when people replaced a typical carbohydrate-heavy breakfast with 2 eggs, post-meal blood sugar dropped by roughly 9 to 12%. Insulin sensitivity improved by about 15%. That's not a supplement. That's not a medication. That's just changing what's on the plate. What's happening here isn't magic, it's physiology. Protein from eggs slows gastric emptying, meaning glucose enters the bloodstream more gradually. Instead of a spike followed by a crash, blood sugar stays flatter for hours. That steady curve reduces the workload on the pancreas and lowers the stress placed on insulin signaling pathways. Over time, fewer spikes mean less damage accumulating silently in the background. But eggs don't just stabilize blood sugar, they actively support the systems that regulate it. Each egg provides about 10% of daily vitamin D, a nutrient directly involved in insulin release and beta cell function. Vitamin D deficiency is common in people with metabolic disorders, and correcting it has been linked to improved glucose control. Eggs also contain choline, an essential nutrient that reduces fat accumulation in the liver. And when liver fat goes down, insulin sensitivity tends to improve. There's also the yolk, which many people still avoid out of habit. That's where phospholipids live. These compounds help repair cell membranes, including the membranes of insulin-responsive cells. Healthier membranes respond better to insulin signals. Eggs also supply selenium, a powerful antioxidant that lowers oxidative stress in tissues damaged by chronically high glucose. In omega-3 enriched eggs, you'll find EPA and DHA fats shown to reduce triglycerides by 10 to 15% and improve blood vessel function, which is often compromised long before symptoms appear. Then there's muscle. Skeletal muscle is one of the body's largest glucose sinks. The more functional muscle you maintain, the more glucose you can clear from the bloodstream without extra insulin. High-quality protein from eggs supports muscle preservation, especially as you age. In fact, people who eat eggs at breakfast report up to 50% less mid-morning hunger. That reduction in appetite isn't just about willpower, it's hormonal. Better satiety means fewer unplanned snacks, fewer glucose swings, and better long-term control. And here's where the story becomes practical. When eggs replace a high-carb breakfast, the entire metabolic tone of the day shifts. You're not chasing energy, you're not fighting hunger, you're starting from a more stable baseline. That stability compounds over weeks and months, showing up as lower fasting insulin and gradual improvements in HbA1c. Some data suggest that eating eggs 3 to 5 times per week can reduce fasting insulin levels by as much as 20%, while improving lipid markers at the same time. Of course, how eggs are prepared matters. Frying them in refined oils or pairing them with processed carbs can cancel out many of these benefits. But when eggs are used intentionally soft-boiled, gently cooked, combined with fiber-rich sides, they become one of the most efficient tools for blood sugar control. They're simple, accessible, and biologically aligned with how the body manages glucose. Still, eggs alone aren't the full solution. They stabilize the start of the day, but they don't address everything that drives insulin resistance beneath the surface. And that's where the next piece becomes critical, because there's another everyday food that doesn't just slow blood sugar, it quietly reshapes the gut metabolism connection in ways most people never consider. But just knowing this isn't enough, because there's another factor that can either amplify these benefits or completely undo them if you get it wrong. Eggs help stabilize blood sugar early in the day, but stability alone isn't enough if the system underneath is still dysfunctional. Many people do everything right on the surface. They eat protein, they avoid sugar, yet their numbers barely improve. And that's because blood sugar control isn't just about what you eat, it's also about how well your body processes it. That's where Greek yogurt quietly changes the equation. At first glance, yogurt doesn't look like a blood sugar food. In fact, many people with diabetes avoid it altogether because they associate dairy with sugar. But Greek yogurt is different. 1 cup of plain, unsweetened Greek yogurt delivers roughly 15 to 20 grams of protein, only 4 to 5 grams of fat, and about 5 grams of carbohydrates. That macronutrient balance creates a low glycemic load that barely nudges blood sugar, especially compared to typical snacks or breakfast options. What makes Greek yogurt powerful isn't just what's in it, it's what fermentation does to it. During fermentation, lactose levels drop, making it easier to digest and less likely to spike glucose. At the same time, beneficial bacteria multiply. And those bacteria don't just stay in the gut. They influence inflammation, insulin sensitivity, and even hormone signaling throughout the body. In multiple studies, adding fermented dairy like Greek yogurt to the diet reduced fasting glucose by 8 to 10% and improved insulin sensitivity by 20 to 25% within just a few weeks. That's a significant shift for something as simple as a daily cup of yogurt. The mechanism is clear. A healthier gut lining means fewer inflammatory compounds leaking into the bloodstream. Less inflammation means insulin can finally do its job. Protein plays a central role here as well. The high protein content of Greek yogurt slows digestion, leading to a steadier post-meal glucose curve. Instead of rapid rises and falls, blood sugar levels remain more controlled for several hours. That steady pattern reduces cravings, lowers insulin demand, and creates a metabolic environment that favors repair rather than damage. Greek yogurt also delivers key micronutrients that people with diabetes are often low in. 1 cup provides about 20% of daily calcium, which supports insulin secretion and bone health. It supplies roughly 30% of vitamin B12, critical for nerve protection and red blood cell production. It also contains magnesium, a mineral directly involved in glucose transport and insulin signaling. Low magnesium levels are strongly linked to insulin resistance, and correcting that deficiency alone can improve metabolic control. But one of the most overlooked benefits of Greek yogurt is how it affects appetite. Casein protein digests slowly, which extends satiety and reduces the urge to snack between meals. In trials, people who consume Greek yogurt as a snack reported about 25% less hunger compared to those eating high-carbohydrate snacks. Less hunger means fewer impulsive food choices and fewer glucose spikes later in the day. Over time, these small effects add up. Regular consumption of Greek yogurt has been associated with A1C reductions of about 0.3 to 0.5% over several months. That may sound modest, but for someone struggling to move their numbers at all, it's meaningful. And unlike extreme diets, it's sustainable. Of course, not all yogurt works this way. Sweetened varieties can contain more sugar than dessert. That's where many people go wrong. The benefit only appears when Greek yogurt is plain unsweetened and used intentionally. When paired with fiber and healthy fats like crushed walnuts or a drizzle of olive oil, its impact on blood sugar becomes even more favorable. This is also where Greek yogurt complements eggs perfectly. Eggs stabilize glucose early. Greek yogurt supports the gut, extends satiety, and smooths blood sugar later in the day. Together, they create continuity instead of chaos. Energy becomes more predictable. Cravings lose their grip, and insulin finally gets a break. But even with stable mornings and a healthier gut, many people still hit a wall, especially as muscle mass declines with age. Blood sugar remains stubborn not because of what they're eating, but because of what their body can no longer use efficiently. And that's why this next food matters so much, because it directly determines how much glucose your muscles can actually absorb instead of leaving it trapped in your bloodstream. By this point, blood sugar may feel more stable. Mornings aren't chaotic anymore, cravings are quieter, and digestion feels calmer. But many people still notice something frustrating: their numbers improve slightly then stall. Not because they're eating wrong, but because their body has lost its biggest glucose-clearing engine muscle. And this is where skinless chicken breast becomes far more important than most people realize. Glucose doesn't disappear on its own. It has to be pulled out of the bloodstream and stored somewhere. And skeletal muscle is where that happens. The more functional muscle you have, the more glucose you can clear without relying on extra insulin. When muscle mass declines, which happens naturally with age, and faster with diabetes, blood sugar stays elevated no matter how clean the diet looks on paper. Skinless chicken breast directly addresses that problem. A 3-ounce serving provides about 26 grams of complete protein, virtually no carbohydrates, and only 2 to 3 grams of fat. From a blood sugar perspective, it's neutral, but from a metabolic perspective, it's powerful. High-quality lean protein stimulates muscle protein synthesis without adding a glucose load. That means you're not just avoiding spikes, you're rebuilding capacity. In controlled trials, diets emphasizing lean protein sources like chicken breast reduced fasting glucose by 8 to 10% and improved insulin sensitivity by 15 to 20%. That improvement doesn't happen overnight, but it compounds. Each meal becomes an opportunity to restore metabolic function instead of eroding it. Chicken breast also delivers micronutrients that directly support glucose metabolism. One serving provides roughly 50% of daily niacin A-B vitamin involved in cellular energy production and insulin sensitivity. It supplies about 40% of vitamin B6 essential for glucose utilization and nerve health. Selenium, another key nutrient in chicken, protects pancreatic cells from oxidative stress, which is a major contributor to beta cell decline in diabetes. There's also phosphorus, often overlooked, but critical for energy transfer inside cells. Without adequate phosphorus, glucose can't be efficiently converted into usable energy. That inefficiency is one reason people with diabetes feel fatigued even when their blood sugar's high. Chicken breast quietly supports that entire energy pathway. What makes this especially relevant is how muscle interacts with insulin. Muscle tissue is insulin sensitive by design. When you preserve or rebuild it, glucose uptake improves naturally. Studies show that replacing higher fat or processed meats with lean poultry lowers triglycerides by 10 to 12% and improves overall lipid profiles. LDL cholesterol drops. Cardiovascular strain decreases. These are not side benefits, they're central to long-term diabetic stability. And unlike many protein foods, chicken breast doesn't come with hidden metabolic costs. Processed meats increase inflammation and insulin resistance. High-fat meats slow digestion in a way that can worsen post-meal glucose responses. Skinless chicken breast avoids both extremes. It's clean fuel. Preparation matters here too. Grilling, baking, poaching, or sous vide cooking preserves protein quality without oxidizing fats. When paired with fiber-rich, low-glycemic sides, vegetables, legumes, or whole grains in controlled portions, chicken breast helps flatten post-meal glucose curves even further. This is where strategy replaces restriction. There's also a hormonal effect that's easy to miss. Lean protein increases GLP-1, a hormone that enhances satiety and slows gastric emptying. That means fewer cravings, fewer late-night snacks, and less glucose volatility across the day. Over time, people who consume skinless chicken breast 4 to 5 times per week see HbA1c reductions of about 0.4 to 0.6%. That's a meaningful shift achieved without extreme dieting. This is why chicken breast acts as a bridge. Eggs stabilize the beginning of the day. Greek yogurt repairs the gut and smooths appetite. Chicken breast restores muscle, the body's primary glucose sink. Together, they move blood sugar control from short-term management to structural improvement. But even with muscle restored and glucose moving more efficiently, one critical threat can still undermine everything: chronic inflammation at the vascular level. And that's where the final food becomes non-negotiable. Because knowing how to manage glucose isn't enough if inflammation is quietly damaging blood vessels at the same time, and that danger is far easier to miss than most people think. After lean protein and smart dairy choices, we now arrive at a food that works quietly, deeply, and over time. No spikes, no drama, just steady control. Walnuts. At first glance, walnuts don't look like a blood sugar food. They're small, calorie-dense, and often misunderstood as something diabetics should avoid. But that misunderstanding has cost many people years of unstable blood sugar without realizing why. Let me tell you a short story. A 58-year-old man with type 2 diabetes once said, "I eat clean. I avoid sugar. I even eat less rice. But my fasting glucose is still high every morning." What was missing wasn't restriction, it was metabolic buffering. And that's exactly where walnuts come in. Walnuts are not designed to lower blood sugar instantly. Instead, they work like a shock absorber for your metabolism. When you eat them correctly, they slow digestion, calm insulin response, and protect your cells from the silent inflammation that makes diabetes worse year after year. Scientifically, walnuts are one of the richest natural sources of alpha-linolenic acid, ALA, a plant-based omega-3 fat. Studies published in Diabetes Care in the Journal of Nutrition show that people who consume walnuts regularly experience improved insulin sensitivity, lower fasting glucose, and reduced HbA1c over time, even without drastic dietary changes. Why? Because insulin resistance isn't just about sugar, it's about cell membrane flexibility. Omega-3 fats from walnuts integrate into your cell membranes, making them more responsive to insulin. Think of insulin as a key and your cells as locks. Without enough healthy fats, the locks become stiff. Walnuts help oil the lock, but that's only the first layer. Walnuts also contain polyphenols and antioxidants that reduce oxidative stress, one of the hidden drivers of pancreatic beta cell damage. Less oxidative stress means your insulin-producing cells don't burn out as quickly. In simple terms, walnuts help your body respond better to the insulin you already have. Now here's the part most people miss. Walnuts work best not alone, but as part of a strategic pairing. When eaten with protein or after a meal, not before they reduce post-meal glucose spikes significantly. One clinical trial found that adding walnuts to a balanced meal reduced postprandial blood sugar by up to 30% compared to the same meal without nuts. That's not magic, that's metabolic timing. Even more interesting, regular walnut consumption has been linked to lower belly fat, which directly improves insulin resistance. And since visceral fat is one of the strongest predictors of worsening diabetes, this matters more than calorie counting ever will. But let's be clear, more is not better. The effective amount is small, a small handful, about 7-10 walnut halves per day. That's enough to trigger metabolic benefits without overwhelming calories. Eaten slowly, chewed well, preferably in the evening or with dinner when blood sugar tends to stay elevated longer. This is why walnuts feel subtle. You won't feel them working tomorrow. But 3 months later, your morning glucose starts dropping. Your cravings calm down. Your HbA1c quietly improves. And that's the kind of change that lasts. Yet here's the warning. Walnuts are powerful, but only if they replace something harmful. Adding walnuts on top of refined carbs or sugary snacks won't help. They must take the place of something that's silently damaging your insulin response. And that leads us to something even more critical than food choice itself. But just knowing this still isn't enough, because there's another factor that's even more dangerous than what you eat, and most people completely overlook it. At this point, you don't need to change everything overnight. You don't need extreme diets or complicated rules. What actually matters is starting small, choosing just one smarter food today, one better timing decision tomorrow, and one habit that protects your blood sugar instead of silently damaging it. When you do that consistently, you'll begin to notice real changes, steadier energy, fewer crashes, better lab numbers, and a body that finally feels like it's working with you, not against you. If this video helped you see blood sugar control in a clearer, more realistic way, save it so you can come back to it when life gets busy and old habits try to return. And consider subscribing to the channel, because here we focus on evidence-based practical medical knowledge that helps you protect your blood sugar, your metabolism, and your long-term health without fear, without hype, and without shortcuts that backfire. You deserve information that empowers you, not confuses you. Stay curious, stay consistent, and take care of your health starting today.